All right, day number 152. It certainly is living up to the marathon status we were told it would be. So, picking up where I left off with the last update, which was about a month ago, that was when Dad was on his way from Theta Clark down to West Allis. He made it to that skilled nursing facility. He was there for a couple of weeks, but then unfortunately, due to neglect, he developed 8 to 10 additional wounds as well as a urinary tract infection. That all landed him at the ICU of Aurora Sinai in Milwaukee, where he's been for the last couple of weeks. So he's been recovering from that. He has some antibiotics that are helping to hopefully resolve those issues. One of the bummers among many are that the kind of antibiotics that they're having to use because of how it seems like resistant these infections are to the medication is going to make it really difficult to deal with future infections just because his body's going to get used to it. It's going to take more and it's just going to be less effective. So that's a bummer. On the bright side, Sinai has been really great. They've kind of hit the reset button and gotten his vitals back to a good place. The wounds and infections are slowly starting to heal up, and they're even starting to try weaning off the ventilator once again, which he hasn't done in a few weeks. I don't think he's done that since he was in Chicago a couple of months ago, but they still would like to try to see what is possible because they do feel like progress is possible. So when I was there, we've had visits that have been pretty up and down as far as hitting my dad on a good day and bad day because of the medications and just ICU delirium from being in a hospital setting over the last few months. It really depends on the window that you catch him in. He sometimes is very sharp. Last week when I was there, he gave a full detailed recap of the previous night's Brewer game. But then a few days later when I went to visit him, he was seeing things. He was really kind of foggy. So it really depends. But last week when he was very clear-minded, we had been talking and a nurse had kind of said, there are a couple of options. We want to get him home, and it's just a matter of when. So the option, kind of was, would you like to just get home as soon as possible? Or if we can get you to a facility and do some further rehab and see what's possible, what would you like to do? And I just kind of opened up the question to my dad, and he said, well, he'd love to get the most, quality of life as he's able to. So if that means going to a facility and fighting to, get off the ventilator and, get a quicker route to getting a speech valve and that kind of thing, he would like to do that. So I was really proud of him being willing to, after all this time in a hospital, being willing to, if it's possible, put in some more time to do that. So that's where we're at right now. The pieces are in place and coming together for him to come home. It's really just a matter of when. We're, just praying that these infections and complications die down enough that he's able to go to a facility and continue some rehab, and then come home, which will be certainly, is what we're all praying for. It'll be a different kind of battle in and of itself, but we're looking forward to having him in his own home again. So just want to thank everyone again for continued prayers. I know that updates have been, kind of few and far between, but there's really just so much happening that it's tough. It's tough to give a clear update. Even this update is kind of vague in ways, just because we don't know exactly how things are going to line up. But we appreciate the prayers, the love. Certainly, I'm passing that along to my dad every time that I'm able to see him. And as soon as we have a clear direction on kind of where we go from here, I'll be sure to let you all know. But thank you again. We appreciate it. Love you all.